Welcome to the 21st Century Man podcast. Today we're doing a deep dive into something that affects, well, a surprising number of us, environmental allergies.
That's right.
We're zeroing in on chapter 12 from the book The 21st Century Man. It's called, appropriately enough, Environmental Allergies.
And it's a really important topic. Even if allergies aren't, life-threatening for most people, they can seriously mess with your quality of life.
Absolutely. That constant itchy-eyed, sneezy, runny nose feeling. The book points out, and it's written by Dr. Matthew Lodwick, an allergist, so he knows his stuff, that this really impacts your mood, your sleep, energy levels.
Even your cognitive function, how clearly you think. And the stats are pretty striking. About a third of all men deal with this.
Wow, a third.
Yeah. But the upside, and this is key, is that managing them effectively can make a huge difference in how you feel day to day.
So our mission today is basically to unpack what these environmental allergies are, look at how you can manage them, and pull out some actionable steps, all based on Dr. Lodwick's chapter.
And it's a great chapter, really clear and informative on a vital aspect of men's health.
Okay, let's start with the basics. What exactly is an allergy? What's going on inside the body?
Fundamentally, an allergy is your immune system going a bit overboard. Normally, its job is differentiating between you, your own cells, and not you, like germs.
Right, the self versus not self thing.
Exactly. But with allergies, it mistakenly flags a harmless foreign substance, pollen, dust mites, whatever, as a dangerous intruder.
And that mistake triggers.
It triggers an inflammatory response. When you encounter that allergen, the immune system kicks into gear, causing inflammation. That can range from, just some annoying itching all the way to anaphylaxis, which is obviously very serious.
The book talks about IgE antibodies. How do they fit in?
Right, IgE, that's immune globulin E. These are specific antibodies your immune system produces if you're allergic. Think of them like targeted heat-seeking missiles.
Okay.
They identify specific proteins on the allergen surface and tag them as harmful, even though they aren't really. It's a very precise but misdirected attack.
So the body's defense system is locked onto the wrong target.
You got it. And that targeted attack, driven by IgE, causes inflammation wherever the allergen lands. Skin, sinuses, airways, maybe even the gut.
And then there are mast cells. What's their job in this whole process?
Mast cells are like little grenades packed with chemicals, mainly histamine. They hang out in your skin, nose, lungs, gut, blood.
Ah, histamine. The word you always hear in allergy medicine ads.
That's the main culprit. When the IgE antibodies on the mast cells detect the allergen, they signal the mast cells to release their histamine payload.
And histamine does what exactly? Makes you miserable?
Pretty much. It's the chief driving factor, as the book says.
Yeah.
It causes inflammation, makes blood vessels leaky, increases blood flow.
Yeah.
That's why things get red and swollen.
Okay.
It also triggers nerves, causing itching, and ramps up mucus production trying to flush the allergen out, which, ironically, often leads to more congestion.
So break it down. How does histamine hit different areas? Eyes, nose, chest?
Sure. In the eyes, it causes the tearing, the itching, that redness. In the nose, you get the sneezing, the congestion, the runny nose. It's the body trying to expel stuff, but the swelling blocks things up.
Right.
And in the chest, it can cause tightness, wheezing, shortness of breath because it constricts the airways.
What are the usual suspects? The common triggers Dr. Lodwick mentions.
The big three environmental ones are dust mites, tiny little critters in dust pet dander, which is skin flakes, not just hair, and pollen from trees, grasses, weeds. These affect men and women pretty similarly.
Got it. And does this change as we get older?
Yeah, the book notes an interesting trend. Just like the rest of our immune system can become less robust with age, the allergic response often weakens too, maybe in your 70s or 80s. So symptoms might actually lessen over time for some people.
Okay, so understanding the what and why is step one. Now, practical stuff. Environmental Control, the book, really stresses this.
Absolutely. Knowing your triggers and then changing your surroundings to avoid them is fundamental. It's the first line of defense, really.
Right. Let's start with dust mites. Those sound unpleasant just by name. What's the plan?
It's a multi-step approach. Number one,
Okay.
in case you're bedding, pillow, mattress, duvet, zip them up in allergen-proof covers. That's huge.
Okay.
Then, regular vacuuming, dusting. Cut down on upholstered furniture and carpets if you can. They're dust mite havens. Cleaning air ducts helps, and crucially, keep indoor humidity below 50%. Mites love humidity.
Makes sense. What about air filters, like HEPA filters? Do they actually help?
The book says they can help, especially maybe if you have pets or if regular deep cleaning isn't always happening. They can also reduce indoor particles when outdoor air quality is bad.
Anything specific to look for if you decide to get one?
Yeah, consider the room size. Make sure it's rated for the volume of air you need to clean.
Mm.
And noise level. You want something you can actually live with running. Dr. Lodwick mentions brands like Blue Air, Rabbit Air, Honeywell as examples.
Okay. Now, the tricky one, pets. What if you're allergic but love your dog or cat?
Yeah, that's scuff. The book is clear. The most effective control is removing the pet from the house.
Which is heartbreaking for many people.
Totally. Recognizing that reality, the book points to allergy shots, allergen immunotherapy as a really viable option if removing the pet isn't feasible. Though if someone, especially with asthma, is having serious breathing issues because of the pet, rehoming might have to be considered.
And what if you don't have pets, but you're often in places that do, like for work or visiting friends?
Same recommendation, really.
Yeah.
Immunotherapy is highlighted as a key strategy for managing those unavoidable exposures, especially since, 2 out of 3 homes have pets. It's common.
Where can people find more detailed info on controlling all kinds of airborne allergens? The book mentions it's a big topic.
Dr. Lodwick suggests talking to a local board-certified allergist, first off, and he points to websites like AAAAI.org, the American Academy of Allergy, Asthma, and Immunology, and nights.ni.gov from the National Institute of Environmental Health Sciences. Good resources there.
All right, let's shift to allergy testing. The book warns about some methods being less than reliable.
Yes, he uses the term quackery for some approaches. He strongly recommends sticking to the validated methods, skin sensitivity tests, and specific IgE blood tests.
And what should people avoid?
Things like laser allergy testing, IgG test, muscle strength testing. The book advises steering clear of those for allergy diagnosis.
So choose your testing method carefully. What do these validated tests actually tell you?
They're good at identifying sensitization, meaning do you have the IgE antibodies for a specific allergen? But, and this is important, they don't really predict how severe your reaction will be.
So how do you figure out the severity?
Mostly by observation. How do you actually react when you're exposed to that specific thing in the real world? That's the best gauge.
Got it. The book also differentiates perennial versus acute allergies. Quick difference.
Perennial means year-round, chronic exposure, often leading to constant symptoms like nasal congestion. These can be harder to pinpoint as allergies sometimes because they're just always there.
Okay.
Acute is more sudden exposure, leading to obvious new symptoms, like bam, sudden sneezing attack after petting a cat.
Okay, makes sense. So after environmental control, we get to medications. The book mentions good over-the-counter options.
Yes, thankfully there are excellent choices available now without a prescription once you know your triggers and have done what you can environmentally.
Antihistamines seem like the go-to starting point for many.
They often are, just because they're easy to get and use. But there's a key difference between the older first-generation ones and the newer later-generation ones.
And the book has a pretty serious warning about those older ones, right?
It really does. Dr. Lodwick strongly advises against regular long-term use of first-generation antihistamines. He cites a study linking daily use of drugs like Benadryl for 3 years or more in older adults to a significantly increased risk over 50% higher of dementia.
Wow, that's significant. Which drugs are we talking about?
Examples are Benadryl diphenhydramine atarax, chlorotrimazine, Dimetapp, Dramamine Tasecond. They all tend to cause drowsiness too. That's a common side effect.
So the later generation ones are the safer bet.
Definitely. They don't seem to carry that dementia risk. We're talking about Zyrtec, Claritin, Allegra, Sizol, Clarinex. Minimal side effects for most people, maybe slight drowsiness for a few, but generally well tolerated.
And they work differently.
Well, they still block histamine, but they're designed not to cross into the brain as easily, which is why they're less sedating. Plus, they're long-acting, usually 24 hours, and work quickly. You can use them as needed, but for regular exposure, taking them daily is probably better for things like itching, sneezing, runny nose.
What about other types of allergy meds? The book calls nasal steroids the most effective.
Yes, overall, nasal corticosteroids are considered the most effective, and many are over-the-counter now, like Flonase, Nasacort.
How do they work?
They don't just block histamine, they actively reduce the inflammation by decreasing the inflammatory cells in your nose.
Yeah.
But you need consistency.
Ah, okay.
It can take a week or two of daily use to get the maximum benefit, and technique matters spray up into the nose, not straight back.
Are they safe for long-term use?
Excellent safety profile for daily use, especially seasonally. The main side effects are usually minor, like headache or nosebleeds, often from technique issues. The book does suggest that if you need them year-round, you might discuss immunotherapy with your doctor, just because long-term data beyond several years is a bit limited.
But for seasonal use, they're generally fine.
Very safe. And using them before pollen season starts and all the way through can actually help dampen down that seasonal allergic response overall.
Good tip. Any other medication pointers from the book?
Definitely talk to your pharmacist. Dr. Ludwig stresses they're an underused resource for OTC questions. He also warns against combining oral antihistamines with oral decongestants because of additive side effects.
And decongestants themselves, like Sudafed?
He generally advises against oral decongestants. Side effects can include high blood pressure, headache, insomnia, plus they're stimulants affecting mood, causing agitation. And they're risky for people with heart disease, glaucoma, thyroid, or bladder issues.
What about the nasal spray decongestants, Afrin and such?
Quick relief, yes, but big warning. Don't use them for more than a few days. You can get rebound congestion. Your nose gets even stuffier than before when you stop. It's due to receptor changes in the nose.
Yikes. Okay, what about herbal stuff? Does the book give any credence to that?
Not much, honestly. Homeopathic remedies, placebo effect, generally ineffective. Things like stinging nettle, quercetin, local honey. Probably also placebo if they help at all.
Any specific warning?
Yes, a strong warning against butterbur. Despite some claims, it's unregulated, quality control is poor, potential for contaminants, and it's been linked to cancer and liver problems. Best avoided.
So if OTC meds aren't enough, what about prescriptions?
The book mentions leukotriene blockers like Singulair and prescription nasal antihistamines like Astelin. They're rarely game changers, though Singulair can be surprisingly helpful for some. But Singulair has that FDA-boxed warning about potential psychiatric side effects, which is serious. Nasal antihistamines might help more than leukotriene blockers for sneeze and runny nose. But overall, the combo of oral antihistamines and nasal steroids is usually the most effective medication strategy. Just remember, meds are temporary relief for a chronic issue.
Which leads us nicely to the long-term solution the book discusses, immunotherapy.
Exactly. Allergy shots or allergy desensitization. This isn't just symptom control, it's about reprogramming your immune system for long-term tolerance. The effects can last years, even decades.
Sounds promising, but how does it work? What's involved?
It involves getting injections of gradually increasing amounts of the allergens you react to. Because there's a small risk of anaphylaxis, a severe reaction. It has to be done in a doctor's office with a waiting period, usually 30 minutes after each shot.
That sounds like a commitment.
It is. You start with frequent shots, maybe twice a week, building up the dose over, say, 30-35 visits. Then you move to monthly maintenance shots, typically for about 5 years total. It takes time, but the payoff can be getting off daily meds and feeling much better long-term.
What about the under-the-tongue drops or tablets? Oral immunotherapy.
Sublingual immunotherapy, yeah. It's common in Europe. In the U.S., FDA-approved options are still limited. Ragweed, grass pollen, dust mite currently.
Is it as good as shots?
Shots are probably more effective for most people, especially with multiple allergies. Sublingual might be better if you're only allergic to one or two things. The big advantage is safety. Much lower risk of severe reactions, and after the first dose in the office, you can usually continue at home.
But find a good allergist for that too.
Definitely. Effectiveness can vary based on the specific protocol and dosing used.
One quick clarification. Steroid injections. Are those the same as allergy shots?
No, absolutely not. A steroid shot gives powerful temporary relief for days or weeks, but it doesn't retrain your immune system. And it comes with risks of systemic side effects, appetite, mood, infection risk, unlike the targeted nasal steroids.
Okay, good distinction. The book also briefly touches on asthma, since allergies are a common trigger.
Right. Asthma involves cough, wheeze, chest tightness, shortness of breath. It's typically reversible, symptoms come and go, often with triggers like infections, stress, exercise, and of course allergies. Rescue inhalers like albuterol help quickly.
Any other key points on asthma?
Tobacco smoke is a huge risk factor for worsening asthma. And interestingly, men seem less prone to developing asthma later in life than women, unless there's chronic pet exposure involved.
And why mention penicillin allergy and insect stings here?
Penicillin allergy is medically important because avoiding penicillin often means using broader antibiotics, raising resistance risks. Good news is, most people lose penicillin sensitivity over about 10 years. Accurate testing, usually skin testing, which is reliable, is key. The blood test isn't great. For insect stings, bees, wasps, etc., anaphylaxis is rare overall, less than 1%. But if you are sensitized, the risk on the next sting is high. 30–60%. Allergy shots for venom are incredibly effective, reducing that risk down to 5% or less. Fire ant shots might be slightly less effective, but still the best bet.
Okay, tons of great info. Finally, how do you find a good allergist if you need one?
The book stresses finding someone well qualified. A good primary doctor is a great place to start for a referral. Look for someone who went through medical school, residency in internal medicine or pediatrics, then a specific allergy immunology fellowship, and is board certified by the American Board of Allergy and Immunology, abai.org. Maybe also nbpas.org.
Any other resources?
Dr. Lodwick mentions his own practice website, www.bayareaallergy.com, for more info on his work.
This has been incredibly useful, really digging into Chapter 12 of The 21st Century Man. Dr. Lodwick lays it all out so clearly in the book.
He really does. It's a fantastic resource.
And we can't recommend enough that you, our listeners, grab a copy and read the whole thing. It covers so much vital ground for men's health.
So quick recap.
Yeah.
We've hit on how allergies work, controlling your environment, the pros and cons of medications from antihistamines to nasal steroids, and the long-term fix potential of immunotherapy.
And the big takeaway, getting a handle on these environmental allergies isn't just about stopping sneezes. It can genuinely boost your energy, improve your focus, and just make you feel better overall. Definitely consider the steps we talked about.
It's worth looking into.
Absolutely. Well, that wraps up our deep dive for today. Join us next time on the 21st Century Man podcast, where we'll be exploring Chapter 13, Circulation, Your Life Depends on It. See you then.